Hello, my name is Dr. Matheka. I'm a surgical resident at the Aga Khan University Hospital in Nairobi. Today, I'll be presenting the findings of a study we did looking at the survival outcomes and prognostic factors affecting survival in patients with metastatic breast cancer. Even though the incidence of breast cancer in Africa is lower in comparison to developed countries, mortality from breast cancer is higher. Higher mortality rate has been linked to advanced disease at diagnosis and inadequate. Up to 77% of patients in Africa are diagnosed with breast cancer at stage 3 and stage 4 disease. There's little data on survival outcomes of breast cancer in Africa, and even less on patients with metastatic breast cancer. Studies have reported widely variable 5-year survival rates of metastatic breast cancer in Africa, between 8 to 39%. These studies have been limited by high rates of loss of follow-up and inadequate treatment of metastatic disease. 5-year survival for metastatic breast cancer in the West ranges from 16 to 28%. Multivariate analysis of several prognostic factors has shown that older age, high-grade tumors, and hormone receptor negative disease are poor prognostic factors. Other factors affecting survival include the size of the tumor, adjuvant chemotherapy, and the site and the number of metastases. Due to the higher occurrence of advanced disease and the unique tumor biology in African populations, it is important to know the survival outcomes of metastatic breast cancer setting and the clinical and pathological factors affecting the prognosis. The primary objective of our study was to establish the 3- and 5-year survival outcomes of patients with metastatic breast cancer. Secondary objectives were to describe the clinical and pathological characteristics of the patients in relation to survival outcome. A retrospective study conducted at the Aga Khan University Hospital in Nairobi. This is a tertiary hospital in Nairobi, Kenya, with a dedicated breast service. Patients have access to multidisciplinary care with chemotherapy, radiotherapy, and surgical services, including complex breast reconstruction. Patients diagnosed with and treated for metastatic breast cancer at the Khan University Hospital in Nairobi from January 2009 to December 2017, with complete records were included in the study. Survival data collected was on progression-free survival, that's the time between first diagnosis of breast cancer and diagnosis of distant metastasis in patients presenting with non-metastatic disease. Survival time, this is the time between diagnosis of first metastasis and death, and overall survival, the time between first diagnosis of breast cancer and death, diagnosed at with earlier disease. Data on patients' demographic and clinical characteristics was also collected, including age, menopausal status, stage at diagnosis, molecular subtype, metastatic site, and the treatment given. In our study, we included 131 patients with metastatic breast cancer. The mean age at diagnosis was 47.01 years, with 58% of our patients being premenopausal and 42% were postmenopausal. Most patients were diagnosed at stage 3 disease, and 30.5% were diagnosed with de novo metastatic disease, that is at stage 4 disease. Invasive ductal carcinoma was the most common histological subtype, and luminal A was the most common molecular subtype. More than 50% of our patients had metastasis to multiple sites, with bone metastasis being the most common, followed by lung and liver metastasis. 87% of our patients received some treatment for the metastatic disease, with 57.3% receiving hormonal therapy and 63.4% receiving chemotherapy. The 3-year survival rate in our study was 31.3%, and the 5-year survival rate was 10.7%. This is higher than previous studies done in sub-Saharan Africa. However, it is lower than studies done in developed countries. Median survival was 22 months. This is comparable to studies which have looked at the survival outcome of African American patients with breast cancer. Our median follow-up period was 35 months. The survival was also compared by stage at initial diagnosis, with patients initially diagnosed at stage 3 disease having the poorest median survival time, whereas those initially diagnosed with stage 4 disease having the longest median survival time. Significant prognostic factors on univariate analysis were liver and brain metastasis, both of which were poor prognostic factors. Luminal A molecular subtype was a significant positive prognostic factor. In conclusion, our study found survival rates of patients diagnosed with metastatic breast cancer to be lower compared to studies done in Western countries, but higher than studies from sub-Saharan Africa. Survival rates were similar to those of African American women. Luminal A molecular subtype was found to be a significant positive prognostic factor, and metastases to the liver and brain were found to be negative prognostic. Our recommendations are studies to be done on larger population databases, follow-up studies in the future to assess the changes in survival with improved treatment modalities and increased access to treatment. These are my references.